So when the meatus gets involved, then there is thyroid enlargement, weight, puffy face, etc. Even elevated cholesterols can happen. So the prescription will vary. For example, if RESA is involved, you just give Pandujigistra, the patient will respond. Once Recta is there, you may give Recta medicines. Once Medas is there, then there is a role for Varanadi, Kanjana, Raudla, etc. So in the same way, once the Shukra is involved, the patient will end up in infertility. So you can see the sequential involvement of the Dhadus in a patient. So then the question arises, what is the difference between a Dhadu involvement and Dhadu Gadavastha? For example, you take diseases like Kushta, you take diseases like Jwara. Dhadu involvement is told as well as Dhadu Gadavastha is told separately. So how we can differentiate that? So let us take the example of a water tap and a clean water beaker. Now the water tap is normal, the clean water is coming into this system. Now here you see the water coming is very clear, but you are mixing mud in the water. So now this is the involvement of the dhatu. So here the treatment is also somewhat easy because that we'll discuss later. You look at the third scenario. Even the water coming from the tap itself is very muddy. Here the water coming from the tap is very clear, but then the mud got mixed with that. But you take here it is the water that is coming from the tap itself is muddy. So here, this is the dhatu involvement or dhatu dushti, where dosha has caused dhatu dushti. So the treatment will be shamana or shodhana, depending upon the degree of involvement of the dhatu. But here, it is dhatu gadavastha because the formed dhatu itself, the disease process has started playing in the formation of the dhatu itself. Here, only the formed dhatu is involved. But here, the disease process has entered such a deeper area so that the newly formed dhatu itself is defective. So here is the role for rasayana chikitsas. Labhopayo hi shastanam, rasadinam rasayanam. We have lot of vyadihara rasayanas like chitraga, leshuna, belladaga, chilajatu, gandhaga rasayanas. Lot of things where the metabolic process in the dhatu itself has to be corrected. So this is the difference between a dhatu involvement and dhatu gadavastha. So this is very important clinically. So how we can identify? We can identify depending upon the severity of the lakshanas, the overall nutritional status and sara of the individual, the chronicity of the disease. So with multiple parameters, you can identify whether the dhatu is just involved or the disease has gone into a dhatu gadavastha. So again, the same thing I'm telling. Here the Medo Dhatu is involved and we gave the simple treatment. But in this case, the Dhatu Gadavastha was there. So a repeated Shodhana measures and Rasayana measures was needed to correct this patient. I hope the concept is clear. Look at this thing. So this is a Dhatu Gadavastha. This is a case of Uttana Vadarakta where the Vrana never heals. So the disease process entered into the Dhatu Gadavastha. So in this patient, the indicators were Uttana Vadarakta with Vrana Upadrava, Pitta Pradhana Prakriti, Madhyama Bala and Sattva. See, this is the way we have to write our diagnosis in a case sheet. It's not just like you write the name Kadigraha and you start writing the prescription. Whenever you write the diagnostic parameters, especially in my college, for my students, I usually encourage them to write just all the therapeutic indicators. So Vada Pittadika Vadarakta, Pitta Kapha Pradhana Vrana, Agni Mandya, and the patient also had Amla Vitta. So the treatment was initially correcting the Amla Vitta and Agni Mandya. Then the Vrana Chikitsa was given because the Upadrava Chikitsa was given first. Then the patient was subjected to Shodhana in the form of Virejana and even Rakta Moksha. Then Eshti Madhu Rasayana was given because here the Dhatu Gadavastha was there. So the patient will not get relief without giving any Rasayana protocol. So after the Rasayana, this is the result. You can see it has completely healed. There is nothing in sort of a what you call Vrana in the patient's body. So this is the importance of identifying the Dhatu Gadavastha and giving the treatment. So that is regarding the Dusha. So we have already finished the Lakshana, the Dosha Vishesha, the Dusha Vishesha. If there is anything to be clarified here, you can unmute and ask. Otherwise, we can go forward.
Hello, sir.
Yes.
Before giving Rasayana, that Shodhana should be needed, na, sir?
That is very important. If at all possible, if the patient's body, including the Sara, Agni, and Bala, is allowing you to carry out Shodhana, then it is always better to do Shodhana and go for Rasayana. But there are some scenarios where the patient is very weak. So we just correct the Agni and start the Rasayana. There is no problem in doing that. But it may not give that much result when you give after a Shodhana machine.
Okay, sir. And my second question is, means Jwara, they have mentioned Dhatu Pachak yogas.
Yes.
So it is necessary to give in all, means when we say Rasa Dushti, Rakta Dushti, we have to give that that kashaya, or you have told if Rasa Dushti you have to go to Pandu Chikitsa.
No,
Uh,
you can take in from everywhere. That is the beauty of Ayurveda, isn't it? You look at yogas like Kalyana Gridhanol, it is told in Jwara, it is told in Sarapa, it is told in Kushta. The same yoga can be given. Why? Because Acharya have developed our pharmacology based on the dosha and dusha. So you can take medicines from either of these things. I'm only telling that you don't call a disease Pandu without seeing Pandutva. But you can take a drug from Pandu and give in Jara, no problem, provided the dusha and dosha that you are planning to hit is the same.
okay, sir. Thank you so much.
Okay, can I go forward? So now next let us see the Roga Marga or Srodhas that is involved, how to identify. So whenever we ask the students to draw the Roga Margas, this is the picture that uh, they usually draw. Yes or no? If it is yes, you put a y, or if it is no, you put n in the chat box. Whenever we think about Koshta, Shaga, this is the picture that comes to our mind. This is the Koshta and these are the Shagas. One no and two y's. Again, others can also post because we have 30 members in this group and I'm getting responses from only selected 5 or 6 doctors. I think all others have kept their mobile open and doing something else, or are you concentrating in the class?
Participants, please respond.
See, you have to think that we are putting a lot of efforts in what you call preparing all these slides, spending 2 hours in our busy schedule. So it will be very nice if you start interacting with us. We'll be very happy. Okay, this is the picture. So this picture is a flawed picture because this is something that came into our mind when we studied modern anatomy. That is the problem. Because you take the hand, all the srodhas are present in the hand. That means all the rasavahasrodhas, raktavahasrodhas, all are present in the hand. So this is the picture that should come to your mind. You think about an earthworm or you think about a tree. Okay, the tree has a central canal and all the layers are surrounding that. Our body is also in the same way. Koshta is something like a picture, a big, what do you call a big picture. It's not picture, it's a picture, big, what do you call drum, where something can be put inside. The process, it is processed, and there is an essence formed, and there are some byproducts formed. So that is Koshta. So the whole angas that takes part in this process will come under Koshta angas. But we have to think one thing: the Susruda's Koshta is different from Charaga's Koshta. Susruda is a surgeon; he cuts open. So that is his Koshta. He cuts open, so that's why he Hridunduga Pupusascha Koshta Ityabhidede, that's very why he wrote. But Charaga's Koshta is something that is different. This is something similar to Charaga's Koshta, this concept. So here the Koshtagni is there, the Ahara comes into the Koshta, it is digested, and the Annarasa is formed. This formed Annarasa is taken up by the Rasadhatu, which circulates like a conveyor belt. So Rasadhatu is just like a conveyor belt. So it goes around all over the body and comes back to its place. And this process is mediated by the Hridaya and the Vyanavayu. So this rasa, this mode of rasa supplies what you call day-to-day nourishment to the already formed dhadus. Simultaneously, there is another process that is going on, that is formation of the sthayi dhadus. So this takes 1 month according to our references. This process takes 1 month where Rasa produces the Rakta Poshakamsha. The Rakta Dhatu Agni acts on the Rakta Poshakamsha. It takes what it wants. Then produces some mala there and Ubadadus. Then the Mamsa Poshakamsha is formed. That is acted upon by the Mamsa Dhatu Agni. Like this, the process goes on. So the Khaleka Bodhanaya or Kedara Gulyanaya happens in such a way. Kshiradadinaya happens in such a way. This is why we eat breakfast in the morning, say 7 o'clock. Around 1 o'clock in the afternoon, we start shiver, slightly trembling because that asthai rasa is reduced. So when we that trembling because that asthai rasa is replenished. The sthai rasa, when it starts depleting, then we get lakshanas like Prayaspandanam, Dauksham, Sweda Bhava, etc. So this is a very beautiful concept. We can study Vishama Jara with this concept. You see, Sandada Jara, Ama forms in the costa directly enters Rasa. So always there is fever. Ama forms enters Rasa. But Sadada Jara, the Ashra is Rakta Dhatu. Why? Because the dosha takes Ashra in the Rakta. So Ama has to form, enter Rasa and then go to the Rakta. So there is a time gap. Tritiyaga again Mamsa. So there is again a gap. So that is why the temperature is Bhinna Sandabo Lakshyate Jara is told. So this is not my input. This is from Ashtanga Sangraha. Sukshma Sukshmadaraseshu Dura Duradayeshuja. Dosha Raktadi Margeshu Chenair Alpas Chirenava. Yadi Margam Chanasesham Bhuishtam Beshaje Aviva. Then I am Vichinna Sandabo Lakshyate Jara, he says. So this is a beautiful concept. So anything in between is Madhyama Roga Marga. That is why if for Madhyama Roga Marga treatment, you get lot of Shara Karma, Agni Karma, etc. Why? Because it's very difficult for medicines to reach in the Madhyama Roga Marga, Marma and all those areas. But the what you call Shaka is very easy. Posta again, it's very easy to give medicines. But Madhyama Roga Marga, it's very what you call difficult to reach the medicines. So that is how you identify the Srotas. So the Srotas can be identified based on the what you call available doshyas that are involved. Next is the Nidana assessment. So assessing the Nidana is very important or integral for managing any disease. We usually fail to identify this because we don't ask that much. Second thing, whenever we start asking, the patients will start telling the routine things. My diet is usual as what you eat, I am also eating the same thing. So in such a way, the patient will respond. So you have to ask about the ahara, vihara, mental factors immediately preceding the illness as well as the prolonged time. For a prolonged time, say preceding 10 years, 15 years, etc. It's very important. So just like in nervous system, we ask about the short-term and long-term memory. Here we have to ask about the long-term as well as short-term exposure to Nidana. That's very important. And also you have to look for the Kala and the environmental factors. So let us take 2 cases of duodenal ulcer to understand this concept. So case 1, the patient present as Pitta Vadaja Shula. And when we assess the Nidana, the patient revealed Kadu, Drava and Shida Aharas. So the treatment was given as Guduchi Adipad. In second patient, the patient had a Pitta Vada Shula itself. But the Nidana was Kadu, Legu and Ruksha. So since this Ruksha component came, the Vidaryadi Grida was given and the patient got result. So same modern condition, same dosha predominance, but different Nidanas, different medicines. So why I am telling this is because such a subtlety in observation will save you too much time. Because usually what we will do, we will start with Guduchadi Kashaya, then we will start with some Kamadudarasa, etc. Then we will switch to the Grida. But in typical scenarios where the patient has good digestive power, but the patient typically tells about such Nidanas, maybe the second change medicine can be Vidaryadi Grida, and the patient will get very good result. And we can save too much time for the patient and money of the patient as well. So we have to apply such subtlety in observing. So same dosha predominance, same modern diagnosis, but different nidanas, different medicines. Let us take another example. A stroke we have already discussed. So here, right Pakshagada, internal capsule infarct, obese and dyslipidemic patient, Sandarpanajanya, so we suspect Avarana. So the treatment is Taulyahara, Avaranahara Chikitsa, and the predominant drug of choice will be Shilajadu. This is another patient, right Pakshagada, again internal capsule infarct, but the patient is very lean, Krisha, a coolie, hard worker, full history of Abhadarpana in his life, Adi Vyayama, Bhaya, etc. And the treatment will be Brahmana and what do you call it? Saumanasya Janana treatment. So the drug of choice will be something like Kalyana Ganda, etc. So the same Ayurvedic diagnosis, same modern pathology that is going on, but different therapeutic indicators and different medicines. So even a hemorrhage can happen in a Sandarpana patient. A hemorrhage can happen in a Abhadarpana. So it's not like there is hemorrhage, there is blood loss, it is Dhaduksha. That is rubbish. That doesn't have any what you call help in treatment as far as my 15 years of experience that taught me. This is another example of intervertebral disc prolapse. A male aged 35, healthy habits, no concurrent morbidities, IVDP following a fall. So there is no history of Avanava, nothing is there. So the predominant presentation is Vada predominant. So the treatment is Shamana and Balya. Another patient, aged 35, constipated, Lakshanas of Pakvasheva, Gadavada and Udavarta are present. Spontaneous IVDP without any fall, spontaneous IVDP. Vada predominant pathology. But here, the Shodhana therapy in the form of Vasti and Shamana and Balya will be there. But here there is no role much for Vasti because the Vada Sthana doesn't have any role. The Samprapti was not initiated from the Vada Sthana. The Samprapti was initiated from an external injury. So here Shamana and Balya will be enough. But here the Samprapti is initiated from the Vada Sthana. So the Vada Sthana Chikitsa or Vastis will be effective. So in such an approach, you can identify in which patient we have to go for Vasti, which patient we can directly go for Pichil and Kadivasti. So such approach is very important whenever you prescribe medicines. So the big question is how to assess the Nidana. So a elaborate history is very important. So long-term dietary preferences, work and other habits, environmental factors, then family details are important. Also other illnesses and what you call other medications that are given to the patient are important. Then we can have something called as a timeline method. So that I will demonstrate. And also we can apply the concept of herd nidana, which I am going to discuss later on. So this is a model diet chart which you can take a printout and keep in your clinic. And for every patient who comes to your clinic, you can give them and ask them to fill these things. So ask them to write down the routinely used items as well as the items that was used immediately before the presentation to your clinic. And also you have to ask about regular timing, skipping of meals, overeating, all those factors has to be right. Then you should also give a daily routine chart where when the patient wakes up, how was the sleep, bowel, maturation, exercise, etc. Then I usually ask my students to draw a long timeline and mark all the things that has happened to the patient. So this is an example. So here, a 34-year-old female patient with quadriparesis since 2 years. So the patient presented to us with myopathy at the age of 32. Now, when we took the history, you look at the timeline. Age 28, the patient had obesity. Age 23, the patient developed a dyslipidemia. And age 14, the patient had thyroid enlargement. So during the long timelines, the patient had these things happening to her body. Now look at the pattern, what is going on. So there is an overall kapha medo dushti, isn't it? So this is a kapha varana janya vada prabhava that has happened. So how we identified that based on not the clinical manifestation of quadriparesis, but we identified that based on what is going on in the patient's body throughout the time period. So this gave us an idea. Then we we started asking specific questions. Then the patient told that right from her childhood, even after her marriage, she used to stay in the same place, which is near a lake where the water is stagnant. So, as per our principles, stagnant water always uh, insults kapha dosha. This may you may find it very absurd in this modern era, but I'm not telling that may I'm not telling that is the cause, but that may be one of the contributing factors. So we gave the patient all kapha avarana chikitsa. The patient improved, but we couldn't. We already told the patient we cannot cure myopathies, but the patient is still living with minimal disabilities. And every 6 to 8 months, the patient will get admitted, take a course of Basti and Chitraga Rasayana. So the patient is comfortable now. I'm not saying the patient is totally normal, the patient is comfortable. So this you can use this timeline method in your practice. This is another interesting case. This female aged 38 came with a diagnosis of dermatomyositis. So typically advanced case where the patient even cannot hold the neck properly because of the neck weakness. So all the Lakshanas pointed out at Lekta Gadavada Lakshanas. But when we deepen the history, the patient gave the history of multiple induced abortions. The patient's husband is in military and he is sexually very active. So after the first delivery, they don't use contraception. So she got pregnant for 6 times, and all the 6 times they aborted using some pills. So we considered Rakta Pradhara as the insulting factor that initiated this pathology. So we gave Rakta Pradhara Chikitsa and the patient started responding very nicely. Again, I am not claiming that we have cured the patient completely, but the patient started getting immense results. But this cannot be generalized so that every dermatomyositis is Rakta Pradhara. No, it's not the case. In this given patient, we consider Rakta Pradhara as an initiating factor. So this is the importance of identifying patient-specific nidanas. But what we usually do is we apply the nidana in the textbook onto the patient and we try to treat the patient accordingly. So that will not give you results. So what you are, if you are not able to identify the nidanas, that is where the concept of herd nidana will come into play. We know the concept of herd immunity as per the current COVID pandemic. In the same way, you take Gujarat, you take Kerala. Gujaratis have a typical diet pattern. Keralites have a typical diet pattern. And you take in the common diseases that are happening to Gujaratis and Keralites, they have their own unique common disorders. So when a group of people start using similar dietary habits, similar lifestyles, etc., they tend to get similar diseases. So most of the times when we fail to identify the nidana in the given patient, you look at where the patient belongs to. What is the herd? What is the herd doing? So that is a nidana. Then why you get a lot of diabetes patient? Why? Because we eat a lot of carbohydrates. As a group, we Indians eat a lot of rice. So we get prameha. So you look at the herd nidana. Don't get disheartened and okay, I don't identify any nidana. It's not like that. If you're not able to identify, then it's the herd nidana that is causing. So basically, the herd nidana can be either sandarpana or apadarpana in nature. And sometimes what happens, some of the diseases can induce other diseases. So we got a patient with quadriparesis, secondarily to TB meningitis. So there the patient's predominant presentation was Jwara. So what we did is we incorporated Jwara Chikitsa into the management of quadriparesis. Because Jwara, in Sannipas Jwara there is one slogan. Vaikalyam va prayachati. So either the Jwara will kill the patient, or sometimes what happens when the Jwara gets relieved from the body, it may produce some permanent disabilities. So incorporating Jwara Chikitsa gave very good result in South. Then Henoch Schonlin purpura in a patient with fever and diarrhea. So there also Jwara Sandapad Raktavitam, it's told in our textbook. Everybody will say dengue fever. I'm saying it's not only dengue, but there are a lot of scenarios where febrile manifestation can lead to bleeding. Even any severe viral infection can suppress your platelet production and the patient can end up in bleeding. So we gave the line of Jwara Disara treatment and the patient improved. We didn't give Rakta Chikitsa, we gave Jwara Chikitsa. Then you get a lot of patients with what you call peripheral neuropathy in diabetic patients. So usually that is nothing but madhumeha, and that meda kapha is causing urustamba. So you give urustamba chikitsa in such patients, you will start getting very good results. So sometimes nidhanarthakara rogas can be a cause in the manifestation. Sometimes, as I already told you, Ubhadra of a Vyadhi can also happen. Then some other specific Nidhanas. This is an example of two cases of psoriasis. In one, the patient was a goldsmith, so he used to be getting exposed to a lot of toxins, including cyanide, right? So incorporating Visha Chikitsa into Kushta Chikitsa gave very good result. In another patient, the psoriasis was triggered by an episode of chikungunya. So in such a scenario, we incorporated Jora Chikitsa into the treatment and it gave very good results. So like that, you look for subtle factors what is going on in the patient. So that is regarding the Nidana. So I emphasized the importance of assessing the Nidana. If there is anything to discuss here, we can discuss, or else we can go into the final part of our session.
Hello, sir.
Yes.
Sir, I have one question.
Yes.
If the patient comes with rukshahar, means vatakar hetu, like jagran, rukshahar, too much of fasting, if he developed any granthi like fibroadenoma or fibroids, so what will be the line of treatment? Because we have to dissolve the granthi using ushna, tikta and katu aushada. So that will increase the vata. So what will be the line of treatment in this patient?
No, actually, that's not the case. You may go for some Kapha treatment initially, but if there is too much Ruksha in the Nidana, definitely you go opt for Thailas. There are a lot of Thailas that are told in the Granthi Chikitsa and even in the Arbuda Chikitsa. Thailas are told. Only thing is that we are not using that. We are always looking through the modern glass that we have put on our life. See, even in hypertension, I have given Vidaryadi Grida and the patient responded. So if you go to a modern doctor, he will tell avoid ghee, don't give ghee to hypertensive patient. That's not the case. Even in dyslipidemia, we have done Snehvana. Even in fibroid uterus, we have given Dhanandara Thaila for Snehvana. And the fibroid improved. That always depends upon the Nidana and the manifestation in the patient. I hope I am clear in that.
Yes, sir. That Vidaryadi growth was came in my mind, but I was means that will dissolve the, because we need Bruhan Chikitsa, so that will dissolve the granthi. That was my question, because I don't have experience, so I have asked this question whether Vidaryadi will dissolve the granthi or we have to do.
No. That will dissolve the granthi means that will start altering the basic pathology that is going on and what that has triggered. So one thing that you have to keep in mind is that this. I will give an example. Two patients with the fibroid uterus. Patient A only has a palpable mass. There is no excessive bleeding, etc. But patient B has excessive bleeding. Now, the treatment line will be different in both of these. In the initial patient, we can give all these Tikshna drugs like Varanadi, etc. But in a patient who is bleeding with fibroid, we may have to go for Stambhana Chikitsa. In both the scenarios, if you assess the dosha correctly and you give the treatment, after the treatment course, the fibroid will shrink. Definitely, it will shrink. So there is no question that because in Ayurveda we treat in a Lakshana-oriented way. In Ayurveda, the treatment modalities are designed in such a way where we have to identify the dosha based on the Lakshana in the patient, and the medicines are also designed accordingly. But in modern medicine, it is solely based on histopathology and microbiology. So that is the difference. Because both these sciences, say the epistemology of both the sciences are different. So our medicines are designed in such a way. So if you want to reduce a granthi and the patient is Vadapadam, use Thaila. There is no issue in that. So there are so many Thailas that are processed in Grandhihara Aushadas and that they are available. Varanadi Grida is available. Indugandha Grida is available. You can use that. Definitely the size will shrink. But only thing is that if you make error in the dosha assessment, it will backfire. That's all.
Okay, sir, got it. Thank you.
Okay, now we can go forward. Next is the Samprapti. This again, I have already emphasized. We usually what we do, the patient underwent Vada Prabhupaka Ahara Vihara, Vada got seated in Kadi Pradesha, patient developed a Kadi Graha. This is what we do. But that's not the usual scenario. The patient might have had Apana Vaigunya. That Apana Vaigunya might have triggered the Kadi Graha. That you will miss. Sometimes the patient might have had Arshas, and that Arshas might have triggered Apana Vaigunya. So if you give Arshas treatment, the back pain will improve. So there are so many scenarios. So what I'm telling is that the Samprapti has to be formulated in the given patient in every clinical scenario. Don't take the Samprapti in the textbook and put on the patient and give medicine for that. You have to formulate the Samprapti in every given patient. So look at what the interactions of dosha dusha has happened. Multiple dosha involvement can happen. There can be a lot of coexistent Sampraptis that is going on. Then sometimes there may be generalized versus localized Sampraptis that is going on. Look at the Roga Marga that is involved. And also you can look at the timeline method, because in the timeline will give you an idea what all things are going on. For example, a patient developed a dyslipidemia at the age of 25. He developed a diabetes at the age of 30. He developed obesity at the age of 40. And he developed MI in the age of 50. So what is the undergoing pathology? Its undergoing pathology is Kaphameda, Dushti, and the resultant Avarana. And that Avarana has caused multiple complications, including stroke, uh, MI, etc. So you have to correct the baseline. So the patient gets stroke, you don't go and do Kaya Sega there, because the underlying Dushti is Kaphameda Dushti. Always you opt for Udvartana, Lekhana Vasti, etc. and then go for Vadahara measures. So you look at the underlying Samprapti that is going on, what is going underneath. Don't only look at the superficial picture. That is very, very important. And in the current era, I always look at the current hidden perspectives. Because, for example, Grahani dosha, you ask patients with back pain, chronic neck pain, etc. 60% of them will have some sort of Grahani dosha. That means burning epigastrium, recurrent altered bowel habits, for example, altered constipation and diarrhea, loose stools, etc. The Namala Pitta features, because our diet is predominantly containing these things which initiate Grahani and Amala Pitta. Then Apana, I have already told, continuous sitting itself will cause Apana Vaigunya. So don't forget Udavarta and Papashegatama. Then Resa is also always Dushita in most of the individuals because of our irregular dietary habits. So always look at Resa. Then Medas, because of this all this Sandarpana that is going on now, Medas is one of the prominent culprit in most of the diseases. So look at that. Then Manas is again, someone asked now the relationship between diabetes and Manas. Manas is related to most of the diseases. So always look for Manasiva Karanas. That is very, very important. Look at other aspects like Ashyapakarshagadi. So here the patient has IVDP and the patient has burning sensation in the lower limb. So usually lower limb is not a Pitta sthana. Now why the burning sensation? You give Pindadaila, etc., Pittahara measures, the patient will get only temporary relief. So here the culprit is Vada. There is Vada Pragopa in the Kosta or in the Pakvasha and Kadi Pradesha. You give Vasti to the Vada sthana, this burning sensation will go off. So that typically indicates that it is a Ashyapakarshagadi. So like that, we have to apply our principles in routine clinical practice. Udavarta, you see a lot of patients we have treated in the principles of Udavarta. For example, this female aged is 36. The patient came with a blepharospasm. The patient was consulting in our Shalaka department for so many months, but there was no relief. Then they came to us. So when we inquired, there was rectal arthritis and chronic constipation. We gave Arsha Chikilsa, the blepharospasm relief, because that Udavarta got taken care of. But if you go and tell this to a neurologist, he will laugh at you. But as Ayurvedic people, we treat the system as a whole. We don't see the system separately. So that this concept is very, very important. So that is regarding the Samprapti. So try to identify the Samprapti in the given patient. Next is the Roga Nirnaya, the diagnostic. How we are diagnosing the cases. So the first question is, do we need a modern diagnosis? What is your opinion? Do we need modern diagnosis? If yes, you put Y. If no, you put no. I will wind up this class within from 5 to 10 minutes. Maybe it's prolonged too much, people will be bored, sleepy.
Yes, sir.
Sometimes it is needed. Any other opinion? It's not needed. So there are a lot of no's and yes. So let us see. See, whenever we are practicing in the current era, we are supposed to have a minimum amount of clinical competence. So modern knowledge is needed. So that we should be aware of the contemporary advances in the epidemiology and diagnostics, modern investigations, and even the new age patients are well learned. So we should be able to identify their what you call dilemmas. We should be able to address their what you call worries. So for all these things, we should learn modern diagnosis, and also it will help you in decision making whether to keep the patient or to refer the patient. So that is why modern diagnosis is needed. So can you tell what is this condition? What may be the most probable differential diagnosis? The patient is having a neck swelling. It is somewhat round. On palpation, it is slightly cystic. And the patient went to a traditional practitioner who gave some oil, and that oil is still there on the patient's body part. What is this condition? Any idea? I am speaking about modern now. Just now we stopped speaking Ayurveda. Now I am asking you, what is a modern diagnosis? Yeah, it is cervical lymphadenopathy. That is sure. What may be the most commonest cause? I have already told it is cystic in nature, not lipoma. It is cervical lymphadenopathy. See, this is a tubercular cold abscess, commonest presentation in our practice. So if you don't know why I told this, because I have seen my teacher has taught me this is a tubercular cold abscess. So I palpated. It is not hard. It is not fixed. So it is not cancer. So now the only thing is it is cystic. So it may be or what you call an infection. This is a common presentation. So when you get this, you at least if it is not TB, it's okay, well and good. But you should investigate the patient for a TB. So we sent the patient. It was TB, and the patient underwent anti-cox treatment. This is another case where the patient came with neck pain and weakness in the upper and lower limbs. Was under Ayurvedic treatment in some other center. But when we examined, the patient had an LMN sign in the upper limb and UMN sign in the lower limb, indicating that there is some compression going on in the cervical spine. So I referred the patient. The MRI revealed a mass. The patient underwent surgery and the patient became okay. So sometimes we should not stick for our own treatment. We should have the modern knowledge. Then only we can know whether we can keep the patient or refer the patient. So like that, there are a lot of conditions that we went through. So that is why modern diagnosis is mandatory. But only thing is that you should keep that separate in your head. Don't mix like inflammation is equal to pitta, gout is equal to manjishta. No, it's not like that. Then coming to Ayurveda versus modern disease, whether we have to compare Ayurveda and modern. This is also another scenario. Personally, I don't compare. I always diagnose the patient under different spectrums in Ayurveda because you take Kasa as an example. Right from infections like bronchitis, pneumonia, allergy, autoimmune, malignancies, all these modern diagnoses can present with Kasa as a predominant manifestation. So we cannot say allergic bronchitis is Vadaja Kasa. It's not like that. It always depends upon at the time of the presentation what is the dosha presence, which is the predominant symptom. If it is Kasa, then you diagnose it under Kasa spectrum, then you start treating based on the dosha. Take Jwara, lot of infections, inflammatory pathology, so all of them can present as Jwara as a predominant manifestation. So Jwara is a big spectrum that includes a lot of modern diseases. Gulma is another spectrum where an abdominal colic or tumor or even inflammatory pathologies will come under the spectrum of Gulma. So Ayurvedic diseases are big spectrums, and a lot of modern diagnoses will fall under. Udara is another example. See, varied diseases, modern diseases will come under the Udara spectrum because Acharya identified Udara as Utsayada Samarthya, the very distension of the abdomen. That's the main criteria where Acharya classified it as Udara. So I say it is industrial obstruction, perforation. All these three are separate pathologies if you go to a modern surgeon. But coming to Ayurveda, it all comes under the Udara spectrum. So Ayurvedic diseases are big spectrums. So don't go for one-to-one correlation. As I told earlier, rheumatoid arthritis can present in Amavada spectrum or they may present in Vadarakta spectrum. So don't tell always rheumatoid arthritis is equal to Amavada is equal to Amavada. It's not like that. In some cases, whenever there is vascular involvement, the rheumatoid arthritis patient will present to you as Vata Rakta, and you may have to go for prescribing Vasha Guluchadi, Vanjishtati, etc. So you identify in which spectrum the patient is presenting to you now. Then you start treating the patient. Then Avastha Nirnaya also is very important. I have already told this example of Parkinson's where usually everyone called Avarana, but here the patient had a Dhatu Kshaya Avastha. So we gave Mamsarasa Prayoga and the patient got result. So Avastha Nirnaya is also very important after the diagnosis. Next is the Rogi Parisha. I'm not going into detail. I'll just give you the importance of Prakriti. This is a usual experiment that I make my students to do. You take a glass beaker, you take a glass of water, and you take a sponge. Then you apply grease in all these three. You apply grease in the glass, you mix grease in the water, and you apply grease on the sponge. Now, if you have to take out the grease from these three substrates, can we do it with the same measure? No. So we may rub on the glass, but we cannot rub on the sponge. The sponge will get destroyed. In the same way, the same disease in different Deha Prakritis, you may have to go for different therapeutic protocols. So that is why a single disease is equal to single drug is not at all the way of Ayurvedic. This is a very good clinical example. This is not my patient, but when I was in a casualty duty, I got called into this patient's room. So the patient was given cotton Jukkadi layer churna for external application. The patient is typically Pitta Prakriti individual who had Sandhigata Vada with the Kapha Vada predominance. But in Sandhigata Vada with the Kapha Vada predominance, cotton Jukkadi is indicated. But in this patient with the Pitta predominance, that was not indicated. So the patient had all these complications. So that this is just to illustrate. I can show you the photo. That's why I told this. There are a lot of examples where an abnormal decision making has made a lot of complications in a patient. So identifying Prakriti and other patient specific parameters are very important in practice. Then the next question that will come to your mind is to differentiate between Shamana and Shodhana. So there are a lot of indicators that you can use to decide whether you should go for Shamana or Shodhana. For example, Alpa Dosha, Ega Roga Marga, Shodhana Anarha patients, recent onset disease without Ubadravas, you can go for Shamana therapy. But if it is a Bahudosha Avastha, more than one Roga Margas are involved, Malavan patient, chronic disease with Ubadrava, you can go for Shodhana. Again, there are various permutations and combinations. For example, Bahudosha Avastha, if the patient is unfit for Shodhana, you may have to go for Shamana. Ega Roga Marga, but a chronic disease, you may have to go for Shodhana. So like this, there can be a lot of permutations and combinations which you can work upon. But these are some of the indicators that you can use. So at the end of the session, I will give you an example where how we can end up in a drug selection. So it should be dosha specific. It should be dusha specific. So to become dusha specific, it is better to select from the respective roga adhikaras. For example, for Rekta, you can take medicine from Rekta Vitta, Pandu, or Visarpa, or Kushta, like that. So like that, you can select medicines from the respective roga adhikaras. You look at the roga avastha. What is the cost of the individual? What is the prakriti of the individual? What is the satmya? What is the vaya? What is the aduravala? So like this, I'm just illustrating one example, that's all. So in a typical scenario of a patient with Vada Vyadhi, so dosha specificity is Vada Kapha, Roga Adhikara is Vada Vyadhi, Roga Avastha is Nirama, Koshta is Madhyama with good Agni, Prakriti is Vada Pradhana, Satmya, the patient is Grita Satmya, Vaya is Madhyama, and Aduravala is Madhyama, then we can go for Gugula Grita. So how I reached into this Gugula Grita? Because of these indicators. So like this, whenever we diagnose any case, and whenever we assess clinically, we assess for clinical parameters or therapeutic indicators which will aid you in identifying the best drug. So then you may ask, now I am prescribing without all these things and I am getting good result. It is well and good. Whatever I have told you, if you apply, then you will get more faster results because you are giving something better to what you have been giving till now. So that is what my take home message is. Anything if it is left, we can discuss. And thank all of you for your patient listening as well.
First of all, thank you so much, sir, for this wonderful session. It was a very good interactive session, rather, I'd say. Now, if any of our participants have any queries, you may ask now. You can unmute yourself and you can ask, or else you can leave a message in the chat box so that I can read it.
Hello, sir.
Yes, please.
Sir, if a patient, some patient comes with thyroid report, if their thyroid report are normal, but still they are on medication, allopathic medication. But whenever the patient comes to us, if there is no lakshana, then how to treat this condition? Because they don't have, we will treat according to the lakshanas. So how to treat this condition if their reports are normal and they are on thyroid tablets?
So basically, in case of thyroid, what you can do is you can analyze the patient's Deha Prakriti, whether the patient is obese, mildly obese, or lean type, and most of the symptoms will be masked by the model cause. I mean the thyroxine. So usually in such scenario, we will have to draw the timeline method and see right before the onset of the thyroid medications, what were the patient's predominant manifestation, and what has enabled the modern physician to identify the thyroid. From that, we will get some lakshanas, and then we can initiate the treatment. And also sometimes there may be some baseline dushti that is going on in the Agni level. So you look at the koshta and see whether there is any pitta or not. If there is no pitta, then you can directly go for what you call Vata Kaphara medicine, because 90% of the times that hyperthyroid patients comes with a Vata Kapha percentage. Only 10% will have pitta predominant percentage. So looking at that pattern, you can initiate the treatment. And if the patient is ready, they can reduce the what do you call thyroxine dose, and we can look at the Lakshanas and you can start treatment.
Okay, sir. Sir, I have a patient, age of 48 years, diabetic since 10 years. But when I ask, means every day she is doing exercise, no adhesion, and her means if she eats more, means like we see, like we can't compare with diabetes, but mostly we see diabetic patient. Like my father is diabetic, so he gets hungry. But if I see that patient, she's not feeling hungry, and if she eats more, she feels like vomiting. She can't eat more than one chapati. So there is
Kapha predominance.
more should.
There is kapha predominance in the body.
Okay, sir, and she has other lakshanas like sometimes allergy, cold, and one more